If you have a parent or a spouse in a nursing home, this video could save their life. I'm going to share 5 warning signs that demonstrate that your loved one isn't receiving the care that they deserve and what you can do about that. Stay until the end because I'll give you a free checklist that you can use during your next visit. My name is David Terry. I'm the founder of the Terry Law Firm. Now, saying that this information could save your loved one's life might sound overly dramatic, but after nearly 25 years of representing families whose loved ones have been seriously injured or even killed by nursing home neglect and abuse, I can honestly tell you that this information is true. So today, I want to arm you with the knowledge you need to protect someone that you care about. Because look, here's the hard truth. Nursing home residents are seriously injured because of nursing home abuse and neglect far more often than most families realize. And the nursing home industry trains their people to tell family members that these injuries are often just part of the normal aging process or unavoidable. And much of the time, that is just simply not true. So the first warning sign is unexplained injuries, bruises, or frequent falls. Now, I know accidents happen, especially with elderly residents. And there are some falls that are unavoidable, but they're rare. So here's what I want you to look out for. Multiple bruises in different stages of healing. Injuries that the staff clearly can't explain. Frequent falls that weren't happening before. Bruises on the inner arms, the chest, or the back areas that don't typically get injured in normal falls. So I had a client whose husband fell 17 times over the course of a few months. And the facility kept saying he was unsteady, but they never did anything to try to prevent these falls. When he would get up to walk, they didn't have somebody with him, even part of the time. And when he tried to get up out of his wheelchair, no one tried to distract him or redirect him. They basically just let him do what he wanted with no effort to stop him. And in the course of pursuing the legal case, it turned out they were understaffed. That's why they weren't providing the supervision he needed. In another case, family members observed odd bruising in an area that was not typical of falls. So they checked on it. They asked probing questions and found out about an abusive employee. So look, don't let the nursing home people brush you off with your concerns with these vague explanations. If you notice unexplained injuries, document everything. Take photographs, ask for incident reports, and require specific answers. Warning sign number 2, declining hygiene and unsanitary living conditions. Look, your loved one should be clean, well-groomed, and living in a sanitary environment. If your loved one is incontinent, there will be times, of course, when they are dirty or they smell of urine. Periodic, temporary issues are not the problem we're talking about. The red flags that you need to be paying attention to include strong odors of urine or feces throughout the facility or for long periods of time specific to your loved one. Dirty or unchanged clothing, overgrown fingernails, unwashed hair, or poor dental hygiene. Soiled bedding that hasn't been changed for a long time. Cluttered and dirty rooms or dirty and unclean bathrooms. We had a client tell us that he suspected that they weren't changing his son's sheets, so he wrote the date on the corner. The next day he asked the staff if they had changed the sheets, and they told him that they had. So he wrote the date on the corner of the sheet again and tucked it back in. The next day, same thing. He did it a third day, and you guessed it, same thing. So frustrated and angry, he went to the administrator's office and he brought her to the room and showed her the 3 dates he had written on the sheets. This is hard to say, and it's not a universal statement, but nursing home employees will lie to you just to get you off their backs. They are overworked, often underpaid, and if they have been working in this industry for a long time, they may have compassion fatigue where they just don't care anymore. Now again, that's not a universal statement, but in my experience, it's often true. Most nursing homes are understaffed, but being short-staffed is not an excuse for nursing home neglect or abuse. So how do you combat this problem? One effective way is to make unannounced visits at different times of day. So for example, if you always visit on Sunday afternoons, they know you're coming and they will cover up any problem areas. So try stopping by on Tuesday morning or Thursday night. Then you'll get a real picture of the day-to-day care. By the way, the more often you visit, the better it is. Third warning sign is unexplained weight loss or signs of dehydration. Proper nutrition and hydration are fundamental to your loved one's health. Watch for noticeable weight loss over weeks or months, dry mouth, sunken eyes, or darkened yellow urine, complaints about being hungry or thirsty, untouched meal trays or food that looks unappetizing, difficulty swallowing that isn't really properly being managed. Malnutrition and dehydration can lead to serious complications, including infections, pressure sores, can even cause death. And we've seen cases in where residents lost 30, 40, or even 50 pounds and experienced severe dehydration that led to acute kidney injuries, all because the staff failed to ensure that the resident drank enough water and ate their food. So how do you combat this? Start here. Ask to see your loved one's weight records and food intake charts. Visit them during eating times and see if your loved ones are eating. Sometimes residents need help eating and they're not getting it. Make sure they're getting that help. Too often I hear stories that family members are told that their loved ones refuse to eat, yet they find their tray sitting in their room too far away for the resident to get to and no one to help them eat. Now, a good facility will make sure that the very basics of proper food and water are provided to your loved ones. Warning sign number 4 is sudden behavioral or emotional changes. While some personality changes can be related to medical conditions, dramatic shifts might indicate mistreatment or neglect. So what do you look out for? Look out for withdrawal from activities that they used to enjoy, an unusual fear or anxiety, especially around certain staff members. Are they agitated or have aggression or mood swings that are new? Are they reluctant to talk about their daily experiences? And then depression or hopelessness. I talked with somebody just this week whose mother was afraid of one of the men on staff and had asked that he not be allowed to help her. After asking this, a few days later, she needed to go to the restroom. She rang her call bell, and guess who showed up? After 30 minutes, by the way. This male employee. Now, she politely asked for somebody else to take her to the bathroom. He sighed and said, well, he'd see what he could do. And about 20 minutes later, a female aide came in and sort of told her off and made her walk to the restroom without assistance. Although, to be fair, she was right next to her. Now, when she was in the bathroom, the female aide left her and didn't come back until after she fell and broke her hip. So look, trust your instincts. You know your loved one better than anyone else. And if something feels off, investigate further. Ask the right questions. The final warning sign for today is medication errors or unexplained health decline. Proper medication management is absolutely critical, especially for elderly residents with multiple prescriptions. So what do you want to watch for? Watch out for missed doses or wrong medications. Nursing homes periodically give a resident their roommate's medication, especially if the staff member doesn't know the residents very well. Second, watch for side effects that suggest that there might be an incorrect dosing. Look for pills found in the rooms or in their clothing or on their bed. Watch for sudden health declines that staff just simply can't explain, but could be related to missing medications or overdosing of medications. And then watch for a lack of communication about medication changes. We represented a wonderful family whose loved one died because staff members were not paying attention to medication warnings. They should have been, and sadly, she died as a result. So ask for a complete list of your loved one's medications and when they're administered, and don't be afraid to follow up on it. You have the right to this information. Look, if you've noticed any of these warning signs, do not wait. Document everything. Speak with the facility administrator. Talk to the director of nursing. And if necessary, contact the state agency that's in charge of the nursing homes of your state. Dealing with nursing home incompetence or lack of truthfulness can be exhausting. But remember, you are not alone. If you believe that your loved one has suffered from nursing home neglect or abuse, we offer free consultations to discuss your options. Now, I've created a free checklist based on today's warning signs that you can take with you on your next visit to your loved one. The link is in the description below, and I'll also put our contact information there. When you're concerned, don't believe the nursing home's excuses, and don't tell yourself that you're overreacting. Trust your instincts when something doesn't feel right. Your loved ones are counting on you to be their advocate. The nursing home won't be. If this video has helped you, please share it with other families who might need this information, and subscribe to our channel for more tips on protecting your loved ones. Hey, thanks for watching this video, and remember, quality care is not too much to ask for. That's what the nursing home industry promises, and that's what your family member deserves.